All right. Well, welcome back. And how have you been since the last time we met?
Okay.
About the same? All right. Well, let's take a look at some of the assessments before we go over the results. So, you took a couple of different assessments. There was a depression inventory, the Beck Depression Inventory, and that's going to give us an overall picture of how you're feeling. It reflects your mood changes and levels of severity, and also over a relatively short period of time. We also had the Beck Anxiety Inventory, which will give us a normal to high range of anxiety, and it's going to show us the anxiety in relation to the depression. So, one of the nice things with this assessment is it'll show the overlap between the two. There is also the Beck Hopelessness Scale, which gives a little bit of an idea about feelings about the future, any loss of motivation, and expectation versus hopelessness. So, this is going to help us look a little bit more of a overall picture and give us a little bit of an idea of how you're feeling as far as depression, suicidal ideation, things like that, and of course the suicide scale. So that'll give us a little bit of an idea because I know you had mentioned some things about that.
Mm-hmm.
Now, we've had to complete these assessments, and I'm just going to go over a little bit of the scoring before we get started. So, with depression inventory, 0 to 13 is minimum, 14 to 19 is mild, 20 to 28 is moderate, and 29 to 63 is severe. So, anything over 29. When we look at the anxiety scale, we're really just looking at minimal, mild, moderate, and severe. And the hopelessness scale is going to be pretty similar. So, just really categories that we'll be looking at. And when we look at your results specifically, it looks like on the depression inventory you were at a 32, so it is a little bit high. And definitely concerned about some of the items on there. And we'll take a look at that in a moment. The anxiety results were moderate, and the Beck hopelessness scale was also moderate. So those are definitely some concerning things about how you're feeling. Now, when we put everything together and we take a look at the suicide scale, definitely gives a little bit of concern. I think partially because we are seeing uh, a little bit of a contradiction between the depression and the suicide scale. It seems like you're feeling pretty low and you're thinking about hurting yourself, but you don't seem to think you feel suicidal. But then you said that you would take your life if you had the chance. So those are definitely some concerning things. And I'm also a little concerned because you are a single white male. So, of course, you are in that higher risk area. Okay. Now, I definitely think we should get working on getting you somewhere where you could feel a little bit safer and maybe relax. That would be the first step.
Go to Tahiti.
And then I would definitely recommend um, some additional therapy so we can really get you feeling a little bit better, get you feeling a little bit more hopeful about the future. Now, we'll take a look at some of the therapy first. The first thing is to get you feeling safe, but then we'll take a look at some therapy. So, but at least now we know how you're feeling.